9 North will have 3 definites and 2 possible discharges.
8 a.m. at the Royal Free Hospital in London. Nursing and ward managers decide who can get an operation today, based on what beds are available.
Morning, Geraldine, it's Ahmed. We can go ahead with all ITU cases.
Ahmed, the theatre manager, has news for a patient on the 7th floor. Peter Gibson is getting his tumour out today.
How's your care been?
My care has been exemplary. I really believe I've got lots of friends who are in the NHS. I think they deserve a lot more than they're asking for. And the people who hold the purse strings in the government, I think they're just playing God.
Scalpel, please.
Peter's surgery went well. The Royal Free has the largest neuroendocrine tumour service in the UK and does the most operations in the country on complex tumours in the gut. Doctors here say they kept cancer surgery going during the COVID waves, but the virus has left a legacy.
The footprint that COVID's left on the work we're doing now is still real and pretty immense. We've got a huge backlog, primarily of patients waiting to have surgery for benign conditions. So unfortunately we have seen a lot of patients presenting with very advanced disease.
So it's that delay of getting into the system.
Absolutely.
Is a backlog from 2 years ago.
Yes, that is certainly playing a part.
Statistics show nationwide 1,000 more people are dying every week than expected. The excess death rates have left questions about the impact of cuts and COVID on hospital care. It's not just delays in operations, but pressures on emergency care, ambulances and A&E. Now add to that strikes by staff.
The NHS can be a bottomless pit of money, but more money would be great. I think striking is currently the only way that us and the nurses and obviously other sectors of society have got to make our feelings known to the government.
What sort of waiting times have you got on there?
So the longest waiting time we have in A&E is 27 hours for an 84-year-old gentleman who's been waiting for a medical bed.
This was an extra area added during COVID to account for capacity.
But since the hospital doubled the space of its emergency department during the virus, demand has not abated.
That strain on the A&E departments across the country has led to questions about whether that's responsible for excess deaths. Do you think that that's a factor?
It is a high risk because we're seeing higher volumes of patients. They're more frail, they're more unwell, they're sicker, and we're doing that with the same amount of resource and the same amount of staff. So the clinician nurse to patient ratio has widened greatly. So there is the potential for that happening quite easily.
What's your message to whoever's listening about what's going on here?
I think a lot of the things that we're focused on is we have no beds. There's a lot of delayed discharges from the hospital, things like social care.
And because of that, despite creating some bed areas in corridors, sometimes there still isn't room.
In the last couple of months, we were seeing patients at the back of the ambulances, so they'll have their blood tests done. The ambulance crew had been really helpful taking the patients to have their scans, but they'll have to come back onto the ambulance. Right. Those could have been up to 6-7 hours on the ambulance before they actually got a bed space.
Is that improving now?
It's improving.
But the people, problems and pressure keeps piling through these doors. And now it's junior doctors being balloted on strike action. The skill and commitment here is without question, but it can't be taken for granted. Jason Farrell, Sky News.